Hi, I'm Dr. Spencer Amundsen. I'm an orthopedic surgeon at Peak Orthopedics. My practice focuses almost exclusively on hip and knee replacements. A large part of that would be complex procedures, complex primary joint replacements, and I also do a lot of revisions. A lot of my practice is focused on people who have had an infection, who had hardware failure, are unhappy with their current joint replacement, or are having problems. I think robotics really has two big advantages: accuracy and precision. We use robotics here for hip replacements, for knee replacements, and for partial knee replacements. I'd recommend people come see me whenever they're having discomfort or pain in their hip or their knee. It could be that they already know they need a joint replacement, or maybe they just would like to know what's going on and get some information. We can do imaging, we can do a physical exam, help them identify who needs to have surgery, who can be managed non-operatively. The choice to have a joint replacement or when to have a joint replacement is kind of when you've decided enough's enough. I can't play with my grandkids like I want to. I can't play tennis like I used to. It takes me longer to do my daily chores. Overall, I'm not happy with the quality of my life, and everybody's a little bit different when they arrive at that point. So it's not so much your x-ray's bad, you have to have surgery. It's more you have arthritis, and when you reach a point where you're not happy with life anymore, then let's do something about it. I try to take extra time with patients to make sure they really understand what their diagnosis is, let them ask their questions, go over treatment options, spend enough time with them that they feel comfortable with the whole process. I guess my overall goal would be to have someone prolong or avoid surgery for as long as they can when it's reasonable, knowing that for a lot of people they'll be so much happier with the surgery. So I try not to be a big salesman, but to lay out the facts, help people understand their condition, what's going on, what their treatment options are, and when I think that surgery might be the best option.